Hi, my name is Dr. Elizabeth Steinberg, and I'm going to talk to you about dehydration. Dehydration is a constellation of symptoms that we see in children or is described to us by parents. One of the most important symptoms that I usually try to identify almost immediately in children is when was the last time they went to the bathroom. 8 hours is my magic number of how concerning it is for a child's dehydration status. They really should have last had urine output at least 8 hours ago. If they did not, then it is concerning, and you should have them evaluated to see if they need IV fluids. If they have peed recently, but you as a parent have a feeling that they're dehydrated because maybe they're not feeling well and they're not eating or they're not drinking and they just don't look right to you, but you say, oh, but they just peed. So they're probably not sick enough, in your opinion, to bring them to a doctor's office or to the emergency room. You yourself as a parent have good intuition and you feel that they don't need that right now, but you do feel that they're dehydrated. One of the things that you could do at home is something called oral rehydration therapy. And this is a very big concept and topic, and I'm doing for you, I'm rephrasing it in a way that I think is very helpful, but it's a bigger topic than what I'm even going to discuss right now. But my definition of it and my interpretation of it is that if your child really is not interested in drinking, or they're throwing up and they can't keep anything down, what I'm going to suggest is that you give them 5 mLs. 5 mLs, that's it, every 5 minutes. And then this way, their body slowly starts to absorb the fluids and they're not tempted to throw up, or if they're tired, they're not tempted to not drink. So by doing this for 20 minutes, 5 mLs every 5 minutes for 20 minutes, you are giving them a little bit for their body to absorb it without making them even more sick. If they can tolerate this after 20 minutes, then you can move up to 10 mLs every 5 minutes for 20 minutes, and so forth. And eventually you're going to get to 1 ounce, which is 30 mLs, and then you're going to get to 2 ounces, which is 60 mLs, and then you're going to get to 4 ounces and 8 ounces. And they're going to slowly start to rehydrate themselves without making them sick. Now, if you get to 2 ounces and your child starts throwing up, go back. Go back to the 5 mLs, give them some time to rest, and go back. And eventually you will replenish the fluids that they lost. It's important to replenish the fluids that they lost in a slow, calculated way. It is this way they're going to recover from their mild or moderate dehydration with fluids in their mouth. And what happens is that as you get more dehydrated, you get more sick and you don't feel good, and it makes you want to vomit, and then when you vomit it gets you more dehydrated. So it's a cycle of vomiting and dehydration and vomiting and dehydration. So by giving the fluids very slowly, 5 mLs every 5 minutes, and then 10 mLs every 5 minutes, all the way up to 1 ounce, you're replenishing them slowly. Now, what fluid are you going to replenish them with? This is another concept. So by giving them free water, which is just regular water without anything in it, it's probably not such a great idea, because not only did they lose water while they're dehydrated, they're also losing electrolytes. So you want to give them something that their body can take in other than just water. But Gatorade or Pedialyte is actually a good option. There is a lot of sugar in it, but it's also an option. I recommend staying away from yellow Gatorade, orange, any color really of Gatorade. I'd recommend definitely not red. If your child throws up red Gatorade, it's going to look like vomit with blood in it, and that's not good. Yellow, bright yellow is also not a great color to throw up. It's very concerning if you call your doctor and you tell them that your child just threw up bright green. So especially if they're a newborn baby, our mind starts to wander in all different kinds of directions. So try to stick to a clear solution, Gatorade or Pedialyte. Ice pops are also very good because it's also a slow liquid that's going into the child's body. They're also great if your child has a fever to help cool them down. And you can make your own solution. I would be careful with making your own solution. I would discuss making your own solution with your pediatrician, because little changes in how you're making your own solution could have dramatic effects on your child. So I would stick to something that you could buy, but essentially Gatorade is salt and sugar and water, so essentially. So it's reasonable to use a reputable source such as the CDC or American Academy of Pediatrics, healthychildren.org, to make your own solution, direct you on making your own solution, and double check it with your pediatrician or me. And by doing this, your child will rehydrate. Document their urine output every 8 hours or less, and that would be a reason to go to the emergency room or call your doctor when your child is sick and not drinking. The last thing I want to mention about dehydration is keeping in mind that your child's not eating is not necessarily dehydrated. Children need to drink and they need to pee. They don't need to eat. They need to eat overall for nutrition and their growth and development. But when they are sick, it's reasonable to not have them eat for a period of time. That time varies, but what is important is that they must drink. And I always remind parents and adults, caregivers, about if your child is admitted to the hospital and they are not eating or drinking. We do not force feed children while they're admitted to the hospital when they're sick. We do give them fluids. So start with the fluids, start small, slow, and build it as you go. And if at any time you're concerned, you call your pediatrician and discuss what the next best step is.